Welcome to the Deep Dive. We are tearing apart the recent flood of executive actions and financial reports on global health. And today our focus is on, well, the tectonic plates shifting right under the world's multilateral health infrastructure.
Exactly. What we're looking at here is much more than just a routine policy change or a budget cut. The U.S. executive action on the World Health Organization is a shock event, a deliberate disruption. It has sent immediate financial uncertainty ripping through these huge institutions, aid organizations, and the companies that rely on them.
Okay, so let's unpack this for you. Our mission is direct. We need to distill what's in the executive order, understand the legal and financial precedents that are now in direct conflict, and then analyze the market volatility that's coming out of this pivot away from decades of global health commitments. We're finding the signal in the noise. Let's jump right in. The source of the chaos. The executive order shockwave. The core action was swift. It happened on January 20th, 2025. Executive Order 44155 was signed, directing the U.S. to withdraw from the WHO. This is the second time this has been initiated in, 5 years?
That's right. And the stated reasons, the rationales, are very explicit. The order cites ongoing concerns over how the WHO managed the COVID-19 pandemic and, other recent crises. The argument is that the organization failed to adopt necessary governance reforms.
And they also focused heavily on what they call a failure to demonstrate independence from political influence. And the big one, the financial equity argument. This point is really hammered home. The U.S. claims it faces unfairly onerous payments.
And to put that imbalance into context, the numbers are pretty stark. The U.S. GDP is roughly 50% larger than the next biggest economy, China. Yet China contributes nearly 90% less in what are called assessed dues, the mandatory payments, to the WHO. The administration is framing this disparity as just unsustainable, a structural failure.
So beyond the political talk, the operational parts of the order were immediate and just devastatingly sharp, weren't they?
They were designed to stop everything, instantly. Money, people, all of it. The order directed an immediate halt of any future transfers of U.S. government funds or resources to the WHO, effective immediately. And it also mandated the recall of U.S. government personnel, contractors, anyone working with the organization.
And it didn't stop there. The order also told the Secretary of State to cease negotiations on two massive foundational documents, the WHO Pandemic Agreement and amendments to the International Health Regulations. This isn't just a funding cut, it's a repudiation of the whole framework. Which brings us to the historical and legal context. And this is where it gets really interesting from a statutory view. Because this move isn't just a repeat of the 2020 withdrawal attempt. It creates a huge legal paradox.
A paradox that is rooted in the very way the U.S. joined the WHO in the first place. See, back in 1948, the WHO Constitution didn't actually specify how a country could leave. So Congress stepped in with a joint resolution that created the mechanism for withdrawal, and it established two non-negotiable conditions.
Okay, so what are those two conditions?
First, the U.S. has to provide a full one-year notice of its intent to leave. That's the easy part. The second, and this is a critical part, is that the U.S. must meet all of its financial obligations for the current fiscal year before the withdrawal can actually happen. The dues have to be met in full.
So if the executive order is demanding a simultaneous withdrawal notice and an immediate freeze on all funds, it's basically put itself in direct conflict with that 1948 congressional resolution.
Precisely. The U.S. assessed contributions for 2025, they haven't been authorized or paid by Congress. So by trying to halt payment and withdraw at the same time, the administration is violating the explicit terms of its own membership agreement. Legally, this creates massive potential for challenges down the road on whether the withdrawal is even valid.
Which puts this whole policy on some very shaky legal ground.
Yeah.
Let's put some hard numbers on this. The U.S. mandatory dues for 2024-25 were about $130 million a year. China's was $90 million.
Right. But that mandatory figure, the dues, that's actually small potatoes when you look at the whole picture.
Yeah.
The U.S. was the WHO's financial anchor. It provided nearly $700 million in voluntary contributions in 2024 alone. That's the flexible money for specific programs and emergencies. Pulling that $700 million plus the dues, that's what creates the real dislocation.
And if we look at the broader global aid environment, the impact is even worse because this wasn't an isolated event.
Not at all. This coincided with the dissolution of USAID, the U.S. Agency for International Development, and also funding cuts from the UK and the EU. This triple threat caused global health spending to just plummet to its lowest point in 15 years.
And when you look at the human cost of that shock, the numbers are they're devastating. Some analyses are estimating that the cost, measured in lives lost from program disruption, could be anywhere from 500,000 to 1 million people. And we're already seeing health system disruptions in conflict zones like Gaza and Ukraine.
The WHO's response was, well, it was damage control. They implemented severe budget cuts across the board, a global recruitment freeze, travel restricted to only the most essential missions, and almost all meetings moved to virtual only.
Okay, let's pivot to the investor context and the market impact, because the scale of this funding loss is staggering. The U.S. was the dominant player. It provided $1.28 billion in the 2022-23 biennium, almost 20% of the WHO's total spending.
But the dissolution of USI is, I'd argue, the more systemic shock. USI managed an annual budget of $42.8 billion. That's 42% of all global humanitarian aid. This wasn't just cash. This was the logistical infrastructure, the consulting, the planning, everything.
And the cancellation is already happening. Projections show that USAID's dissolution will cancel about 25% of all international cooperation programs, effective immediately.
We're seeing immediate, severe disruptions to these massive life-saving programs. The Global Fund to fight AIDS, tuberculosis, and malaria, and Gavi, the Vaccine Alliance, they were immediately hit by the loss of U.S. funding.
A perfect example is PEPFAR, the President's Emergency Plan for AIDS Relief. The freeze on those funds has already halted HIV clinics in El Salvador and stopped the distribution of preventive meds in Guatemala. These aren't abstract cuts. These are services stopping tomorrow.
And the humanitarian modeling is grim. Even modest funding cuts to malnutrition programs are projected to cause tens of thousands of additional child deaths. One analysis on Nigeria estimated nearly 19,000 additional child deaths if funding is cut by just 49%. The speed of the withdrawal is what's so deadly.
So we've covered the international fallout, but the financial exposure isn't just overseas. U.S.-based companies are also facing massive headwinds.
They absolutely are. We have to remember the money that flows back to the U.S. in the form of contracts. For every dollar the U.S. paid in assessed dues to the WHO, the government calculated that 46 cents flowed back as procurement contracts that supported American businesses, American suppliers, American jobs. That 46-cent pipeline just went to zero.
And for you, the investor, that 46-cent flow was a steady, reliable revenue stream. It supported companies supplying everything from medical devices to consulting, and that predictable revenue just vanished. It means contract backlogs, liquidity risks.
Beyond money, we risk losing intellectual access. U.S. public health research now loses access to, quote, invaluable and irreplaceable data. This data is coordinated through 72 WHO collaborating centers across 18 U.S. states and D.C., a huge scientific loss.
And for the travel sector, the risk profile changes immediately. We're a very mobile country, nearly 183,000 international visitors arriving, and 270,000 U.S. citizens departing daily in 2023. This high volume is now more exposed. Why?
Because without the WHO's central coordination, you get delayed detection of global health threats. Think new influenza strains or antimicrobial-resistant bacteria. When the international sentinel system is weakened, U.S. travelers and borders become more vulnerable instantly.
It sounds like a perfect storm of crisis and vacuum.
Yeah.
So what does this mean for the geopolitical landscape and, where are the investment opportunities?
Well, the loss of U.S. financial power creates a huge vacuum. Other major economies, particularly the EU and BRICS nations like China, are now positioned to gain more influence. They can either fill the funding gap or provide their own alternatives.
What's fascinating is the political response we're seeing from recipient countries. African nations like Nigeria, they're not just waiting for a new donor. They are using this moment to push for self-reliance, or what they're calling health sovereignty. They're reframing health as a national economic priority, not something based on dependency.
And that creates a new mandate for domestic investment. They're focused on building resilient national systems, local manufacturing, local supply chains.
Amidst all this institutional chaos, is there a technology bright spot that's, sort of insulated from this?
Yes. The consistent expansion of artificial intelligence in diagnostics and surveillance, that remains a very high potential area. Its adoption is continuing across all income levels, from high-income genomics to low-income remote disease monitoring. It's a growth sector that's somewhat separate from these aid channels.
That structural shift from centralized Western aid to decentralized national health sovereignty, that is the key strategic takeaway. This is a market dislocation.
Exactly. And that dislocation creates a dual investment opportunity.
Yeah.
So let's transition into our This Is Not Financial Advice segment. The key insight is that large, predictable U.S. aid flows have been violently replaced by decentralized, regionally managed health spending.
So the market is structurally broken. Let's talk about how traders could capitalize on this chaos. Lay out the outrageous but plausible trade idea.
Okay, the idea is a dual-armed geopolitical health short-long. On the short side, you target U.S.-based, publicly traded professional services or large contractor firms whose revenue models rely heavily on subcontracts tied to U.S. foreign aid budgets. Think companies heavily reliant on USAID, Global Fund, or PEPFAR flow-through funds.
So you short the legacy Western contractors that were tied to the DC spigot. Why is that short so immediate?
Because their revenue visibility just dropped off a cliff. The contract freezes from the executive order, create an immediate liquidity and backlog crisis. Their entire business model, built on stable, multi-year federal contracts, is now facing, sudden arrears.
And what's the corresponding long position?
Simultaneously, you establish a long position in mid-cap, regionally focused healthcare tech and logistics companies, especially those in high-growth African markets.
Yeah.
We're talking about firms in nations like Nigeria that are explicitly pushing for health sovereignty.
The thesis being that the new national fiscal priority will replace the old donor dependency.
Precisely. These local firms are structurally positioned to benefit. As national budgets prioritize resilient local supply chains and digital infrastructure, they step into the void. They're solving a newly mandated national imperative, which provides a much stronger, more sustainable demand signal than transient foreign aid ever did.
A compelling pivot from dependency to self-reliance driving a very specific trade. So, to quickly recap the essentials of this deep dive, the executive order created an immediate funding crisis for global health. But this action has simultaneously accelerated geopolitical shifts toward alternative power structures and mandated regional private sector health solutions.
Which leaves you with an important question to think about. If this abrupt action forces African and Global South nations to build resilient, self-funded, digitally enhanced health infrastructure independent of Western aid, will the long-term unintended consequence be a more robust and decentralized global health system? And if so, where does capital flow next to facilitate that pivot?
We'll leave you with that thought. Thanks for joining us for the deep dive into this pivotal moment in global health governance. We encourage you to explore the context further on your own.